So it's our Friday injury report. We have Dr. Stephen Stache with us. Good morning, Doc. How are you?
Good morning, gentlemen.
Good to see you again. Thank you for visiting. We appreciate that. Let's go over some of this stuff. Now, we know you're not caring for the players, so we pick your expert brain. Yeah. So, Doc, the opening kickoff, Van Sumeren goes down. It looked like an ACL, kind of a scary kind of moment. Such a shame, man. Yeah. And you being such a sports guy, like I know your heart goes out to these athletes. You know, and especially a kid that worked this hard, was a linebacker, now comes as a fullback, and you lose your whole season, basically.
Yeah, I take it to heart as a former fullback myself. So, you know, it's really a shame to see
I knew we loved you for a reason. I didn't know you were a fullback. That's fantastic.
But, yeah, I mean, it's a lot of speculation. It's hard, but when you see a guy go down and he's grabbing his knee, you know, it always makes you a little nervous. And it's one of those, like, you know, you got to go when you get taken off in such an abrupt manner. But then we all get sidelined by, you know, the spitting event. So
right.
That's really, and it's all gone.
You're right. I know. I felt bad for him because we went from like, oh, that's awful. And then all of a sudden the loogie happens and it's like, wow. Yeah. And that's all we talked about until the game resumed. Crazy stuff last night. And then, you know, Landon Dickerson, who has been such a beast, kind of gets rolled up his back. Ooh. And man, it's tough.
Poor guy got his knees, got his back, you know, limping around in the playoffs last year. Tough guy. Back injuries are tricky. You know, they can be severe. I mean, I don't know if you've ever had sciatica. Yes. You get patients come in the office saying like, "Cut my leg off. Like this is horrible. I can't live this way." You know, I can spot them in the waiting room when they're hurting so bad. But you know, football players are also at risk for stress fractures in the back. That's another one that you kind of got to be aware of. So, you know, there's a little bit of a dynamic here, but herniated discs are probably one of the most common that we see in not only athletes, but the lay population. Discs are the shock absorbing pad between the vertebrae, and they're kind of like a jelly donut, you know. It's a really good metaphor because it's a firm outside and a soft, squishy inside. And so when you get a herniated disc, that jelly shoots out and starts irritating nerves, and that's where it can start to radiate down the leg. Tends to be one of those ones that you don't want to sit on. So if you ever get symptoms, like you probably want to get in sooner rather than later. No. But you know, these guys that are playing and they get access to good resources and you know, it's always nice to take care of a tough guy like Landon Dickerson because you know they want to get back and play. So you know, you see the motivation in those types of guys.
Yeah, is it? You almost need to kind of steal a week or two of just rest for him or just recovery. Yeah. You know, what do you think?
I gotta say it's a delicate balance because sometimes people like totally retreat, and when they shut it down, it doesn't go well. You know, there's a happy medium where you want to be engaged and active, and you got to still use your core. Because if you don't, it just delays the process of healing. So I tell patients a lot of times, you just got to find a way through the weeds. You got to figure out, like, can I move and walk and stretch? Because if you can, then you're keeping things active and you're taking the pressure off of that area. But just laying in bed, I can tell you, is not a good option.
Yeah. It's so interesting. When you brought up the sciatica, I was just curious, why does it come and go? Like there'll be moments where you go, oh my God, it's the worst pain ever, and it lasts a week or whatever, and then you'd be good for 6 months before it comes back again.
Yeah, nerves are tricky. I kind of always say it's like a light switch, right? Like when you switch it off, there's still electricity flowing. It's just not going to the light, right? But when you switch it on, boom, there it goes. And so like you move the wrong way, nerve gets a little irritated, bang, you're feeling it. You move the other way and it's not that bad. And so you're doing okay. It can be very dependent. And then, you know, the classic, like you feel bad for a day and then you sneeze the wrong way and then bang, here it comes again.
Yeah, it's the truth. When you as a doctor and a football player, you could talk to this a lot. So you have halftime, they go on and play almost 10 minutes, and then there's a weather delay, significant, an hour. So what does that do to a football player having to go through halftime, come back, and then sitting again for an hour?
That's the worst. And like, it just totally derails all the momentum, not only from the gameplay, but also from your body. Like, and these guys on the professional level, like they have a system, they have means of which they treat their body. Like it is very, very regimented. And so it's really hard. Shut me down. I was out, not
Yeah.
watching the game for that long. It's like, forget it. I can't stay up and then come back and see patients all day. But yeah, it's almost like you got to re-engage your mind. You got to re-engage your body, get that mental headspace going again. Really, really tough. You hate to see it happen. It's bad for the fans. It's bad for the TV. It's bad all around, but you can't change the weather.
Yeah. Yeah. I know. Isn't it great to have it back, Doc?
It's always good to be here, guys.
Right? And isn't it great to have football? You're
It's awesome.
such a sports guy. So
it's hard to believe that it's back already. It's just like, wow, just like summer's over, football.
I know. It's the only saving grace as the summer ends, right? But football is the gift at the end of it. So,
exactly.
We'll take it. Doc, thank you so much, man. We love always having you. You're terrific. We love everybody over at Rothman. Thanks, buddy.
Have a great weekend.
You too, pal. Dr. Stephen Stache.